Hello everyone, today we are going to talk about membrano proliferative glomerulonephritis. Fine. As I had already told you, we need to remember just with this name what happens. So you see, what does this name denotes? Membrano proliferative glomerulonephritis. That means which membrane? What is the membrane that is present in the kidney? It is the basement. What is proliferation? Proliferation means there is a proliferation of the cells, isn't it? And glomerulonephritis. Okay. So membrano proliferative glomerulonephritis, it encompasses the diseases which all results in an abnormality in the membrane and also causes a proliferation of the cells. That's it. So what are the most common causes which results in membrano proliferative? One is hepatitis, and the other one is heroin. That's all you should know about membrano proliferative glomerulonephritis, right? Now again we are going to talk about diffuse proliferative glomerulonephritis. So what does the diffuse proliferative mean? Diffuse is nothing but, see, in the glomeruli can be affected either focally or diffusely. Only few of the glomeruli might be affected, or diffusely the glomeruli might be affected, right? So when any disease will result in a diffusely, when it affects the glomeruli, in addition to it, when there is proliferation of the cells, it is known as diffuse proliferative glomerulonephritis, and this is commonly seen in SLE. In addition to it, you need to remember a word which is frequently asked in USMLE, that is wire looping. So why this is called as wire looping of the arterioles? This is because the arterioles, because of this disease pathology, it becomes so thick like a wire in SLE. Therefore, it is denoted as wire looping of the arterioles in diffuse proliferative glomerulonephritis. Now we are going to see about rapidly progressive glomerulonephritis. As the name says, this glomerulonephritis is going to rapidly progressive glomerulonephritis. So what does this mean? It means, say for example, in some diseases, say for example good pastures, and also in vasculitis like Wegners, they are suffering from glomerulonephritis, isn't it? Right. So here there will be a rapidly progressive, they will be maintaining their status, like they will be having a nephritic syndrome only, they will be having abnormal lab values, they will be having symptoms, but they will be in a steady state. All of a sudden all that will deteriorate. That means they are progressing to rapidly progressive glomerulonephritis. Fine. This is commonly seen in good pastures and in Wegners and in vasculitis diseases, particularly Wegners, as I had already told. What you need to know that here we see Fibrin crescents in biopsy inside the glomeruli. So why do we see Fibrin crescents? I had already told you the kidney is been rapidly deteriorating or it is failing. The body will not keep allowing the kidney to deteriorate, isn't it? So here it will try to somehow patch up the kidney and it will try to work. Therefore, it will be sending a fibrin cells, it will be sending a supporting cells, it will be sending inflammatory cells to get the kidney, in an attempt to get the kidney cured. It is not going to happen. Finally, it is going to deteriorate. Therefore, these fibrin crescents will be present inside the glomeruli when we do a biopsy in a patient suffering from rapidly progressive glomerulonephritis. Understood? Is it clear? This is what is important. Thank you for listening. Have a good day.